Clinical and theoretical application of the fascial distortion model within the practice of medicine and surgery. The fascial distortion model, F.D.M, is a groundbreaking approach that offers new insights into musculoskeletal and neurological conditions. Instead of seeing these issues as isolated problems, F.D.M suggests they are caused by specific changes in the body's connective tissues, known as fascia. There are 6 primary types of fascial distortions, each with its unique characteristics and symptoms. 1. Trigger bands. 2. Herniated trigger points. 3. Continuum distortions. 4. Folding distortions. 5. Cylinder distortions. 6. Tectonic fixations. What is a trigger band? A trigger band is a type of fascial distortion characterized by twisted, wrinkled, separated or torn fibers within banded fascial tissues, such as ligaments and tendons. These distortions result in a burning or pulling pain along a linear pathway in the body. The fascia, when functioning normally, consists of closely approximated fibers that maintain their structure and allow for smooth movement. However, when distorted, these fibers behave similarly to a twisted zipper or a Ziploc bag that has become unzipped, leading to discomfort and restricted movement. Dr. Tipaldos described various subtypes of trigger band like twist-like trigger band, wave-like trigger band, crumple-like trigger band, and knot-like trigger band. Diagnosis of a trigger band. The diagnosis of a trigger band is primarily based on the patient's verbal description of pain and their body language. Patients with trigger bands typically describe a burning or pulling sensation along a specific linear path, and often accompany this description with a sweeping motion of their fingers along the affected area. This body language is a critical diagnostic tool, as it points directly to the pathway of the distorted fascial band. Key diagnostic signs include a sweeping motion with fingers along the painful area, indicating the pathway of the distorted fascial band. Verbal reports of burning, pulling, or tightness along a specific line or area. Where to find trigger bands? Trigger bands are found in banded fascial tissues throughout the body, particularly in areas subjected to high levels of mechanical stress. Common locations include shoulders, often along the anterior shoulder pathway, involving the bicipital groove. Forearms and arms. Trigger bands here can affect the functioning of the upper limb. Neck. The lateral neck is another area where trigger bands commonly develop, often extending from the shoulder pathways. Trigger bands can develop in any banded fascial tissue that experiences mechanical distortion, making them a common source of musculoskeletal pain. Treatment focuses on physically correcting the fascial distortion to restore normal function and relieve pain. How to treat a trigger band? Trigger band technique is a manual method used to correct these distortions. The primary goal of the treatment is to physically untwist the distorted fibers, reapproximate separated fibers, and, if necessary, break fascial adhesions that may have formed due to chronic injuries. Steps in treating a trigger band. 1. Determine the pathway. The first step in treating a trigger band is identifying the specific pathway of the distortion. This pathway often follows a consistent pattern across individuals. For instance, the anterior shoulder pathway starts on the proximal anterior forearm, runs superiorly over the bicipital groove, up the lateral neck, and terminates at the mastoid process. 2. Palpate the starting point. The starting point is where the treatment begins. It is often located at the intersection of the afflicted fascial band with a corresponding crossband. This point is typically tender and irregular in texture. 3. Re-zip the trigger band. Using the thumb, the physician reapproximates the separated fibers by applying steady and firm pressure along the length of the fascial band, much like re-zipping a Ziploc bag. The thumb is dragged superiorly along the skin, ironing out the wrinkles in the fascia and restoring its normal structure. Trigger bands are a type of fascial distortion often described by patients as pulling, burning, or tightness. Close-up of the physiotherapist using their thumb tip to apply pressure along the pathway. Treatment involves using the thumb to iron out the twisted fascial band. Ensure you treat the entire path to prevent reformation. A trigger band is a twisted fascial band with separated fibers that, during healing, reconnect with collagen. Movement and load guide fibroblasts during healing, but resting leads to adhesions, which obstruct future motion. In the Fascial Distortion Model, F.D.M, an acute trigger band has no adhesions while a chronic one does. Adhesions can be broken, turning a chronic trigger band into an acute one. Heat without movement accelerates adhesions, making the problem worse. Rest and immobilization are not recommended in F.D.M. as movement is crucial for proper healing. The precautions for the F.D.M. trigger band technique: 1. Prioritize pain tolerance. Keep discomfort manageable. Avoid pushing beyond the patient's limits. 2. Steer clear of acute injuries. Never treat areas with fresh injuries, fractures, or active inflammation. 3. Watch out for health conditions. Be cautious with patients who have osteoporosis, blood disorders, or vascular issues. 4. Protect post-surgical areas. Avoid treating near recent surgeries to prevent disrupting healing tissues. 5. Ensure correct diagnosis. Verify the pain source before treatment to avoid mistreating non-fascial problems. 6. Apply controlled, precise technique. Use the right amount of pressure and treat the full pathway for best results. 7. Focus on hydration and tissue health. Ensure your patient is well hydrated and consider their tissue condition. 8. Emphasize post-treatment care. Recommend stretching, rest, or exercises to prevent reformation of the trigger band.